President, you just announced the results of the vote, and that's good news because it means the Senate has just taken another important step toward passage of CARA, the Comprehensive Addiction and Recovery Act. I see my colleague, Senator Whitehouse, is on the floor. I want to thank him. I want to thank colleagues on both sides of the aisle for moving forward on this legislation that will help us to save friends, family members, our neighbors, communities that are struggling with addiction. This is a really important opportunity for us to be able to move forward on legislation that is comprehensive, that is bipartisan, that has a companion bill on the House side, so there's a very good chance that we can get this to the President's desk. It's the only bipartisan legislation that is comprehensive and evidence-based, and it's critical we move forward with it. In addition to Senator Whitehouse, who I talked about, I also want to thank Senator Ayotte, Senator Klobuchar, and 42 bipartisan co-sponsors for their support. More important to me, frankly, is the support around the country this legislation has. We now have, Senator Whitehouse, I think over 130 groups around the country who are supporting this legislation. This includes doctors and nurses, healthcare professionals, also law enforcement, people who are in the trenches, dealing every day with treatment and recovery, those who are focused on prevention and how to ensure people can not just be treated for addiction, but try to keep people out of the funnel of addiction. We started working on this legislation about 3 years ago. We started by hearing from experts around the country. We had 5 conferences here in Washington where we looked at all the issues, including criminal justice, women in addiction, the science of addiction, youth prevention, recovery issues, substance abuse impacting our veterans, a number of issues that enabled us to write legislation that actually makes sense, that will make a difference in our communities. These 130 groups around the country are focused on getting this bill passed because they know it's going to make a difference in our communities. If enacted, this will help states and communities develop and implement these evidence-based practices that we've looked at from around the country. It expands prevention and educational efforts to prevent prescription opioid abuse and the use of heroin, increases drug disposal sites to keep medications out of the hands of youth. It also authorizes law enforcement task forces to combat heroin and methamphetamine and expands the availability of overdose reversal drugs like naloxone, which are really miracle drugs, and provides not just the naloxone, but also more training to our law enforcement officials, to firefighters, to other emergency responders. In the criminal justice system, CARA will help promptly identify and treat individuals suffering from substance abuse and expand diversion and education efforts to give individuals a second chance. Frankly, it's going to help to get people into treatment rather than going into the criminal justice system. Locking people up hasn't worked. If people are being arrested for possession alone, for using, this legislation will help to divert those people into the treatment to get them back on their feet. CARA also authorizes resources to expand treatment in general, including medication-assisted treatment, again, based on the research that's been done around the country. It allows veterans who are discharged for a substance abuse disorder to use drug courts as they recover. So it provides actual grants to these veterans treatment courts that are doing a terrific job. I've toured these in Ohio, talked to some of these veterans who've been through these programs, and again, it helps get our veterans back on the right track. Rather than ending up in jail, they end up in a treatment program with other veterans helping them and supporting them where they can begin to deal with their addiction and mental health issues. CARA supports recovery programs, including those focused on youth and building communities of recovery. This happens now at our colleges and universities increasingly. We want to support that. It also creates a national task force on recovery to improve ways to address the collateral consequences imposed by addiction. One of the most important aspects of this legislation expands drug treatment for pregnant women who struggle with addiction and provides support for babies born with neonatal abstinence syndrome, babies who are born with addiction. Recently, my wife Jane and I visited Rainbow Babies and Children's Hospital in Cleveland, Ohio. We toured the neonatal unit. If you haven't done this, it'll break your heart because you find there an increasing number of babies who are born, again, with this addiction, the neonatal abstinence syndrome. Unfortunately, when you look at what's happened in Ohio, we've had a 750% increase in the number of babies who are diagnosed with this neonatal abstinence syndrome just since 2004. 750% increase. I'm told in some of our states now, 10% of the babies are being born addicted. I've also been at other hospitals around our state, including Cincinnati Children's, St. Rita's in Lima, Ohio. And my wife last week went to Nationwide in Columbus. Every single one of these children's hospitals is experiencing the same thing. What I've learned from these incredibly compassionate nurses and doctors who take these newborns through a withdrawal process is that the number of babies who've been exposed to heroin or prescription drugs continues to grow. The problem's getting worse, not better. These hospital visits serve as yet another reminder that addiction is a disease. It's a disease that has to be treated like other diseases, and it's a disease that can impact anyone. It's wonderful that these caring nurses, doctors, and others are working to try to ensure that these babies become healthy. We don't know what the long-term consequences are, but we need to do more to avoid the addiction in the first place and better treat it when it occurs, and that's what this legislation does. Specifically, the measure takes steps to help women and babies by expanding treatment for expectant and postpartum women, authorizing the Department of Health and Human Services to award grants to ensure these women have access to evidence-based treatment services. That's in this legislation. It also reauthorizes residential treatment programs for pregnant and postpartum women struggling with addiction. There's a great center in Columbus, Ohio called Amosith. I had the opportunity to visit. It's a treatment center. The average length of stay there is almost 2 years. Their results are unbelievable. They allow women to come with their babies, with their children, to go through treatment together. So there is hope. There are treatment centers that are doing a great job. We want to hold those up and encourage more of that around the country. Finally, the legislation also creates a pilot program for state substance abuse agencies that allows funds to be used to target women who are addicted to opiates and provide family-based services to those women in non-residential settings. So it both helps on the residential side, but also with the non-residential outpatient side. Helping these women and helping these babies is just one aspect of this bill, but it's a very critical one. And as we work to turn the tide in the struggle against addiction, it's one we should all be focused on. The good news is that the bipartisan momentum we've seen here tonight is building, and I think the Senate's ready to move on this legislation this week. I know there are other amendments that have been filed. The deadline was today, and I hope we'll have the opportunity to go through some more amendments as we did last week. But meanwhile, we've got strong support and strong momentum, as we saw tonight, from both sides of the aisle. Both Republican and Democratic leaders have lined up to support this legislation. We need to pass this bill, and we need to get it signed into law so that it can begin to make a real difference in the lives of the people we represent. As the heroin epidemic in Ohio and around the country has reached crisis levels, I look forward to working with my colleagues to get this bill over the finish line here in the United States Senate, and then get it passed in the House where there's companion legislation, get it to the President's desk, and enable this United States Congress to play a role as a better partner with state and local government and with our nonprofits around this country to be able to address this growing heroin epidemic around our entire country. Thank you, Mr. President. I yield back my time.